Namaste, Dr. Avishta here, and today I'll be talking about how to stop feeling dizzy and causes of dizziness. So, first and foremost, let us understand what is dizziness. So, dizziness is nothing but a manifestation of loss of balance in your body. So, balance in your body is determined by five various mechanisms. So, first is your brain, your ears, eyes, nerves which supply your spine, and nerves which supply your feet. So, these are the five mechanisms or organs which are involved in maintaining balance in your body. Now, if there is a problem with any of these, then the manifestation of a symptom of dizziness is there. But the dizziness can be associated with other symptoms which will help determine which organ is causing the problem. Let us talk about causes of dizziness. So, what are the causes of dizziness? So, when there's a problem in your brain related to blood flow, especially a part of your brain which is known as brain stem. So, if there's a problem due to blood flow there, then you'll have a manifestation of dizziness. Now, next is ear. So, in the ear, in your inner ear, there are certain tubes, and these tubes are filled with fluid and calcium crystals. Any of these calcium crystals, if they are displaced from where they are supposed to be, then of course, again, you will have dizziness as a manifestation of your symptom. अगर nerve related problem है, say the nerve lining is affected or there's some pressure on the nerve due to various reasons, or just the function of the nerve supply to your spine or feet is affected in any way, फिर of course आपको dizziness एक symptom की तरह manifest होता है. तो ये organ related है. अब causes में अब थोड़ा और अगर हम deeply जाते हैं, first let's talk about द ब्लड फ्लो विच आई स्पोकन अबाउट. तो ब्लड फ्लो में अगर प्रॉब्लम है, जैसे अगर स्ट्रोक हो सकता है या ट्यूमर हो सकता है या ब्लॉक्ड आर्टरीज हो सकते हैं, तो डिजीनेस के साथ ही साथ आपको दूसरे सिम्टम्स भी हो सकते हैं, और ये समझना बहुत इंपॉर्टेंट है. सो इफ यू हैव डिजीनेस विद अ सिवियर हेडेक, with nausea, with weakness or numbness in any part of your body, then it could be related to a stroke, और फिर आपको immediately डॉक्टर के पास जाना चाहिए. नेक्स्ट, अगर ईयर रिलेटेड डिजीनेस है, तो डिजीनेस के साथ ही साथ नोजिया भी हो सकता है, ईयर पेन, फीवर, लॉस ऑफ हियरिंग, रिंगिंग सेंसेशन इन द ईयर. अगर ये सिम्टम्स आपको एक्सपीरियंस हो रहे हैं, देन ऑफ कोर्स अगेन यू हैव टू गो इमीडिएटली टू योर डॉक्टर, क्योंकि ये सिम्टम्स कुड बी इन्फेक्शन रिलेटेड या कुछ और कारण भी हो सकता है विच हैज़ टू बी अटेंडेड टू immediately. If your dizziness is related to a loss of balance, especially while getting up from sitting position or positional change especially, then it could be a blood flow related problem also, like a drop in blood pressure. And then of course you do have to mention the same to your doctor, who will then look into or teach you certain exercises to help prevent that. नाउ लेट्स मूव ऑन टू मेडिकेशन. तो कुछ ऐसे दवाइयाँ भी होती हैं जो आप लेते हैं जिससे डिजीनेस हो सकता है. तो इनमें से जैसे फिट्स या सीजर की जो दवाइयाँ होती है, या डिप्रेशन की दवाइयाँ जो होती है, या बीपी की कुछ दवाइयाँ होती है, उनसे एक साइड इफेक्ट की तरह डिजीनेस भी मैनिफेस्ट हो सकता है. नाउ हाउ डू वी treat, or how do we stop feeling dizzy? Now, how to stop feeling dizzy is very closely related to the cause of dizziness. So, इनमें से जो most common होते हैं, जो serious या critical नहीं होते, उनके बारे में approach में बताती हूँ. So, if your dizziness is due to a condition which is known as vertigo, तो vertigo में क्या होता है कि जैसे मैंने पहले बताया था कि ear में there are some calcium crystals that maintain balance, and if they are displaced, तो फिर आपको dizziness feel हो सकता है. So, if it is vertigo related, there is obviously the symptoms are very characteristic, which is position change से dizziness worsen होता है. जैसे head position जब आप change करते हैं तो dizziness worsen हो सकता है. If your dizziness is diagnosed to be related to a postural drop in blood pressure, जिसको हम medically postural hypotension भी बोलते हैं, then the only advice that I would give is when you get up from lying down position the bed, sit on the bed for about 10 to 30 seconds and only then get up and walk. This will prevent any excessive dizziness or any falls or injuries due to the dizziness. If your dizziness is diagnosed to be related to an infection, तो ये infection can be related to the nerve of your ear, and most common होते हैं viral infections. And इसमें हम usually antiviral drugs prescribe करते हैं to get the symptoms under control. Another common symptom or another common disease related to the ear which can be controlled is known as Meniere's disease. तो इसमें ear fullness, ear pain, loss of hearing, ringing sensation ये सब होते हैं along with dizziness. इसमें usually unfortunately we don't know the cause, so we tell the patients to follow a low salt diet to prevent that excessive fluid formation in the ear. Any other cause of dizziness, if diagnosed and found to be critical or serious, of course you will be treated in a hospital setup, depending on if it's a stroke or anything related to your heart or any severe infection. Accordingly the treatment is given. So if you have any further doubts or questions, please feel free to reach out to us. You can also mention certain home remedies that you might be following at home to control dizziness, things that have worked for you. We would love to hear a lot more about them. So goodbye, and looking forward to talking to you all again very, very soon. Thank you.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.